When someone is diagnosed with uveal melanoma, also known as ocular melanoma, it's crucial to keep an eye on their health for any signs that the cancer may have spread outside of the eye. Some factors can indicate a higher risk of metastatic uveal melanoma. Tumor size: the larger the tumor, the higher the risk of it spreading. Finding the tumor early can lead to smaller size and better chances of the cancer not spreading. Blood supply to the tumor: tumors with many blood vessels have a higher likelihood of spreading. Presence of an orange pigment over the tumor. Age at diagnosis: younger age at diagnosis is linked to a lower likelihood of the cancer spreading. New research suggests that gene mutations and changes in the chromosomes may also be predictive of cancer spread. After finishing your cancer treatment, you'll need to have follow-up appointments with your oncologist or cancer team to check for any signs of the cancer coming back or spreading. The schedule for these follow-up appointments can vary depending on your doctor's preference. During these appointments, you may have blood tests every 6 to 9 months to check for certain substances that could indicate metastatic uveal melanoma. Your doctor may also perform a liver function test to see if there are any tumors in the liver. Imaging tests, such as ultrasound, CT scans, MRI, and PET scans, are also part of the follow-up process. These tests can help identify any tumors in the liver before symptoms of liver damage appear. It's common to have these tests once or twice a year for up to 5 years, and possibly longer. Ultrasounds are good at detecting larger masses, while MRIs provide the best results overall. If uveal melanoma has spread to the liver, there are usually multiple masses rather than just one or two. When uveal melanoma spreads, it most commonly affects the liver, but it can also spread to the lungs, skin, or bones. If you notice any concerning symptoms, it could mean the cancer has spread. Your doctor will need to do more tests to check for this. If the cancer has spread to your lungs, you may experience symptoms such as coughing, coughing up blood, shortness of breath, chest pain, fluid around the lungs, loss of appetite, and unintentional weight loss. Your doctor may perform blood tests, chest X-rays, and other imaging tests to diagnose lung metastases, as well as a surgical procedure called mediastinoscopy to take tissue samples for biopsies. For bone metastases, common symptoms include pain, easily broken bones, spinal compression leading to numbness or weakness in the legs, back pain, loss of control of bladder or bowels, and high levels of calcium in the blood. To diagnose spread to the bones, your doctor may recommend X-rays, bone scans, and biopsies. If the cancer has spread to the skin, a skin biopsy is usually done. Skin lesions can vary in appearance, including red or pink spots, flesh-colored lumps, or smooth and rough textures. Areas commonly affected include the scalp, abdomen, trunk, chest, arms, legs, face, and neck. In order to determine the risk of uveal melanoma spreading, oncologists use various tests and procedures. Firstly, biopsies are not common for eye cancers, but your oncologist may recommend one to check for gene changes that could increase the risk of cancer spreading. The results of the biopsy can also help your doctor determine the right targeted drugs if mutations are present. There are several types of biopsies that can be performed for eye cancers. Fine needle aspiration involves a thin needle being inserted into the eye to remove a sample of gel-like liquid for testing. Fine needle biopsy is similar to aspiration, but the needle is inserted directly into the tumor itself to remove cells for testing. Incisional or excisional biopsies allow a surgeon to remove part or all of the tumor for testing. In addition, liquid biopsies are blood tests that can check for tumor cells in the blood. While this type of test is not widely available yet due to the required equipment, the American Cancer Society states that liquid biopsies can help predict the risk of cancer recurrence.